Today I'm talking about extractions, a really hot topic for a lot of people in the salon and treatment room, how they like to squeeze their spots, get everything out, they do it at home, and it always ends up leading to having a really big conversation. So I need to put a video on here to try and help you guys understand what you can safely extract at home and also how best to do that as well. I've even seen recently this really funky game where you can pop your own pimples, and it is literally probably something with that satisfaction for these people that like to squeeze and get a bit squeeze happy. Use this because it's better than trying to actually damage anything on your skin as well. You've got one skin, so it's important that we actually look after it really well and not cause any trauma or damage to the skin. So doing something like extractions can be done in a very incorrect manner, could cause trauma, breakouts themselves, and long-term damage into the skin there as well. So this video is for you if you're a pimple popper. So first off, let's talk about what we actually can squeeze. So generally, most people will understand the T-zone, the head, the nose, the chin as the slightly oilier areas of the face. Even onto the cheeks, you may well see more visible pores, more enlarged pores in this area compared to other sections of the skin. So this tends to be the typical place for people to squeeze. And it's getting that angle right and doing it all and getting that out, and there's the satisfaction of that. Now, what you're actually squeezing is the actual follicle that you see within the layer of the skin. Now, these little follicles have hair that wick out the actual oil. So the hair acts as that natural wick to produce and bring it out onto the skin. And if that produces too much or gets too clogged up, you get also a lot of dead skin cells. Within that pore is still skin. You still get dead skin cells shedding on there as well. And if that blocks up and fills up too much, then you can obviously squeeze out what is left and what is all this in there. But also, not along just with sebum and dead skin, we're also getting things like pollution and dust particles that can get into those pores as well. If the skin's not cleansed and it's not wicking out this enough on its own, you can obviously end up having a bump, a blackhead, a breakout come out on that as well. Now, this little cap that goes over the top and stops everything from coming out will actually turn black over time, and it's almost then like a slightly harder scab. And what that blackness does as it hardens, it sort of stretches these pores. So you can see the importance of having good thorough cleansing and why people actually like to extract, to keep that actual process clearing out. Now, it's not a necessity job unless you've got that sort of thicker skin type that holds on to this oil and doesn't wick out well enough, or you're overproducing the oils as well if you're over having too much clogginess going on in the skin. So these whiteheads, these blackheads are perfectly fine to extract. What you can't extract are things like the actual bumps that you see that are turning red, okay? If you've got a bump under the skin and you can't see the pore or the opening, it's not something for you to start trying to squeeze away at. What you'll end up doing is more damage to that skin, weakening it and giving it like a weak spot in a way for that to sort of come back, and also potential for actually scarring, marking, causing pigment and drawing blood. Now, if you draw blood at any time in any of these sort of extraction works, you're too rough and you've actually burst down the very superficial layers of the skin into where those blood capillaries are, and you've managed to sort of damage that skin. So that's a real stopping point. You should not get to that level, please. So I'd like to try and show you a little bit of a demonstration about pustulas, about the inflammation and that within the skin. So when you see pus on the skin in a spot, that is not the bacteria, that is actually the bad gunk that needs to come out. What actually that is the byproduct of your natural immune system killing the bacteria and encasing the bacteria to take away all of its oxygen and to starve it and kill it for your body to clear it out. So just like a tube of toothpaste, if you took the top off where you've squeezed or scratched the surface of the skin, you've now opened that to the oxygen in the air and are now giving the bacteria within your skin house for room for growth and for growing and multiplying. So you're now feeding the bacteria that's within the skin. If you think about all the layers of the skin that we are, if you've got something that's sort of building up congestion within the skin, it's not just pore, this is actually within the deeper layers of the skin. When you squeeze your spots, out comes your pus, but where does the rest of it go? Back down into the skin as well. So while you might get the satisfaction of seeing the pus come out on the surface of the skin, you're also potentially pushing a lot of that down back into the dermis, lower into the skin, and perhaps maybe the next day that pustular spot has reappeared. Perhaps you're then weakening that skin down, you might get reoccurring spots in the same place, or very commonly you've actually burst through that layer of sterile skin and start spreading this bacteria around underneath, and you may well get another little spot that comes up next door to it, and you start a sort of chain reaction. So those closed over spots, the inflammation ones, the ones with the big pus things, the best thing you can do for that would be to have some sort of warm compress, because the heat will actually stimulate your bodies to actually send more messengers there to repair and to sort of soothe it. And also putting something over the top that is very antibacterial, that's going to kill off those germs, kill off the whitehead, absorb any excess oil and sebum in there, and kill the bacteria at the same time as well. Many products available that I can teach you for that. So squeezing those spots are the no, squeezing the little blackheads, the whiteheads are a yes. So if you're going to squeeze at home, most commonly most people will use their first fingers and squeeze. And now the most damaging thing would be your nails. So you need to make sure that your nails are not digging into the skin at any point, because you think of the sharpness of that, how much damage that can push, how soft is your skin compared to that nail. You wouldn't want to go scraping away at it. So the best thing to do as well would be to wear gloves. After a shower, a bath, after your skin's sort of been warm and the pores have actually managed to sort of just soften a little bit and open slightly, it's softening up the bacteria, it's softening up that skin and that pore and everything to be able to get everything out. Once you're at that softer point, it would be easier to do some extractions. Now in salon we would actually potentially steam if the skin could tolerate it, and also using things to actually really break down some of that dead skin and everything that we're seeing and the comedone within that pore. And then we would be safely extracting. So using gloves will actually, one, keep away a little bit of bacteria from your hands transferring to and underneath your nails to spread, but also protecting those nails a little bit as well. So please invest in some gloves at home, it makes a big difference. And then with some thickened tissue or folded over tissue, I need you to wrap those fingers up. Now we're giving yourself a little bit more cushioning and everything in there. So this is what we do when we're in professional treatments. When we're doing your extraction work, we are actually like making our little finger puppets to be able to do these extractions properly. So if we imagine my skin is a bit like this sponge where you can see all the little porous holes and everything, and if I'm going to squeeze that spot and just push down, look what happens to that layer of the skin. Not a lot, it just goes down. Nothing really on the top can get its way up or out or anything. I'm just actually depressing. If I look at on the edge there, look, I'm just depressing the rest of the skin, not much is going. If I just dig down, can you see the layer of the skin is being so flexible like this, would actually just push that down into the skin. So what we actually need to do is, using the flats of our fingers rather than the tips, try and push the skin together and bunch it up. And can you see that layer obviously is bunching up? And so where we're bunching up, now we've got the sides of our fingers just to give it a little rock and a movement, and what will happen is out will pop your blackhead, whitehead, comedone, any of that that's in the skin. That way as well, we're not targeting one individual pore because they're so tiny. We're actually collectively taking what's there. Now, if nothing comes out of that, then it may well not be soft enough, deep enough, ready to be able to have enough to be able to come out onto the surface. So if you really go and go and go at something, you're actually potentially causing more damage to that skin, rather than just waiting, doing some extra cleansing, some extra exfoliation that might work, treatments as well, medicated treatments that might work there to try and clear that. But also, if you're just working and working and working in one position, you might not be able to get it at the right angle. You might need to actually change. So think about the contours when it comes to the nose, that we're not just squeezing the nose in one position. It's really hard to get the ones that are in there. So you're actually talking about squeezing the nostril and manipulating it. So if we're just doing a skin, we don't need to just do one. We need to really get those fingers, work it up and give it a good wiggle to pop that out. So the safest thing is, if it's not coming out after 2 attempts, please just leave that alone until later on you might be able to go back to it. And not all will come out. So some people as well in professional treatments, I can see they have a lot of congestion, build up and comedones in the skin, and when you come to doing extractions, even with steam and treatment products, they're still not letting go of the skin, and that generally is a sign of a dehydrated skin as well. And the dehydrated skins will really try and hold on to all of that oil and keep there as well. Now, one last tip, a big myth buster for you all, is the pores do not have any muscles around that surface of the pore or within that structure to be able to close up. So if anybody is trying to sell you a product on closing your pores, rubbish, because you have not got muscles for them to stretch open and back. So to be able to avoid having enlarged looking pores, keeping them clean and clear like this will actually make them look and appear smaller and diminished. And also things like your primers as well, when having regular exfoliation, will make that surface of the skin look so much smoother. If you have had blackheads a lot, or long-term blackheads that have been there, sometimes when they're extracted they can look like they've left a little hole in the face. That is the pore, and that is what has come out, and that won't be closed up, but that would certainly look a lot fresher and clearer and smoother than it would do with this sort of plug in the skin. So if you have any other further questions on extractions, or you've got anything else you want tips and advice on how to do that, please get in touch. Hopefully my video has given you some help. Thank you.